Hi, I'm Justin, the pharmacist here at Rite Aid today. How are you?
Hi, how are you?
Pretty good. I see that you got one of our surveys there. Had you had a chance to fill it out?
Yeah, I picked it up at the counter. I'm just finishing up, but I'm not quite sure what it's about.
What we're trying to do here is try to see what types of things you've got going on in your life here, and maybe trying to find out if there's any reason why that may or may not help you to take your medication a little bit more effectively.
Oh, okay. Well, I think I'm done. There you go.
Sure, thanks. Would you like to discuss this a little bit?
Yeah, sure.
Okay. Looks here to me like you've got some issues potentially with work or school. Would you mind if we talked about that?
Yeah, no, I think that'd be all right.
Okay. Can you tell me what you've got sort of happening in your life right now?
Well, to be honest, I'm unemployed, and so I've been trying to find a job here. I actually just got out of a job interview, so it's been pretty stressful time.
Yeah, the economy's not been doing us too much of a favor lately.
Not at all.
Absolutely. Not at all. Well, how do you think that that's playing into you being able to take your medications?
Well, if I think about it, you know, it's been filling out a bunch of applications and going out a bunch of job interviews, and money's not coming in sort of the way that it was coming in, and sometimes just with all that stress, I just forget.
Yeah, that's certainly understandable. You know, here at Rite Aid, we have some ideas and some strategies that we could potentially use to help you to remember your medications a little bit better, but also to help you to afford them a little bit better. Would you like to go over those?
Sure, if you have the time. Yeah,
okay,
that'd be great.
Absolutely. We've got a couple different options for you. In line with helping you to afford your medications a little bit better, we offer a couple different programs. We've got our Rite Aid Savings Card program, which would be able to help you to save money on both brand and generic medications. We've also got the potential to work with your doctor to help you to get switched potentially to some generic medications that may be available if you're on brands right now, or combine some of your medications into combination products, which would help you have a little bit less out-of-pocket expense, but also may help you to remember to take your medications a little bit better.
Okay.
As far as remembering in general, we could set you up with a pill box that may potentially help you to set out the whole week,
I've heard of this.
as opposed to just once a day trying to remember that all the time. And we could also set you up on our Rite Aid Courtesy Refill program, which would fill your medications for you automatically so you wouldn't have to remember about them. And the last thing that we could try is putting you on our Rite Aid Savings program. That would save you money on both brand and generic medications.
Okay.
Which one of those sounds like it might be good for you?
Well, right now the financial, the affordability of the medication would be good. So if you can call my doctor and see about switching medications to a generic, and the Rite Aid value card, is that what it's called?
The savings card.
The savings card.
Yeah, absolutely.
I think those would be the two that would be most helpful for me right now, given the circumstances.
Well, perfect. We can definitely do that. Let me run back over here to the pharmacy, get your prescription finished up, and we can talk a little bit more about some of the changes that we can make.
Oh, okay.
Just before I go, would you mind letting me know how this interaction helped you out today?
Well, I think it was great. I mean, just taking the time and offering me some choices was pretty good, so I appreciate that.
Perfect. Okay. Well, we'll see you in a few minutes here.
Thanks.
You're welcome.
Appreciate it.
Oh, no problem.